But when you talk about uncertainty, it's the lack of knowing about a specific topic, whether to do arthroscopy for knee surgery, whether it's to do a mammogram for breast cancer, whether it's to do a PSA for prostate cancer, whether it's to have a surgery on your heart in terms of bypass as opposed to other medical alternatives. So there's all this uncertainty about what needs to be done. And obviously patients and families want some clear guidance in terms of what should be done, and your partner's in the process, there's no question about it. Any physician that doesn't engage you as a part of the process, I would tell you, you should find another physician. Jerome Grootman said it right in his book. So anybody who's afraid of questions or afraid of internet information you bring in, that should be a red flag that you're not going to the right person. I'll say that. Can you edit that out, by the way? So when I look at uncertainty, there's a concept called reducible uncertainty, right? Which is, as a physician, you don't want to be in because, if you're uncertain because you don't have enough knowledge, enough skill, enough experience, that's not good for your patients, right? But no matter what you do, by and large, all decisions are fraught with the concept of irreducible uncertainty. Right? So there's a real difference in uncertainty we're talking about that you just don't know enough or don't have enough experience, right? As opposed to having all the knowledge in, right? And I'll read a quote from a very famous physician, mathematician in this country, David Eddy. I don't know if anyone's heard of David Eddy, but he's the king of medical decision-making and statistics. And David wrote, not too long ago, that uncertainty creeps into medicine through every pore. So anybody that takes a dogmatic stance on any questions you have to deal with, you really have to be somewhat curious about what permits him or her to have that kind of certainty. That brings me to the flip side of uncertainty, and that's certainty. So I don't know if you all deal with physicians or healthcare givers that come across with dogmatism. So there's reasonable certainty, and there's unreasonable certainty, right? So the two cells you don't want to be in is in unreasonable certainty, where you think you know, when in fact you should know better than you don't know. That is a huge number of practicing healthcare givers in this country, period. And you don't want to be in the reducible uncertainty, because it means you haven't done your homework, right? Irreducible uncertainty and reasonable certainty are reasonable cells. Often you don't know which cell you're in at times, and that's where the partnership becomes critical to the process, right? And we can talk about that a little further. Jay Katz, who was a mentor of mine at Yale, is a professor of psychiatry and analyst, and a professor of law, which is unusual, right? Wrote, I think he wrote this as a lawyer, but as a analyst. The denial of uncertainty, like people who don't tolerate uncertainty, don't believe it should exist, the proclivity to substitute certainty for uncertainty is one of the most remarkable psychological traits that he's ever seen. We are educated for dogmatic certainty. And I'll tell you, Susan didn't tell you that I'm also president of the program directors of internal medicine nationally. And we absolutely train for certainty. And that's absolutely wrong. Right? So unfortunately for you all, our graduates are not looking at the world through the prisms that they should in terms of really respecting uncertainty.
What I think has been helpful for myself and patients working together in this arena of decision making, and because I think that what you're talking about in this doctor-patient relationship is how do you create that, or how do you shape that around these very complicated issues. And I think one of the things that I was thinking about that often I found we're doing in my work with people is making, in some ways, obvious that you are making a decision. And that there is something to talk about here to get to whether it's certainty or close to certainty or what. Because I think a lot of times people, you go to the doctor, and this is, because I have so many people that's happened to. You go to the doctor, they do their exam, and they say, here's an echocardiogram, here's the lab test, and I'm going to send you to the orthopedist for your back. And you take those and you do it. And, and then people tell me what they did, and they said, oh my God, you've just made huge amounts of decisions there. And it's not even clear that those decisions were made and what they mean or how they mean. So, in some ways, I think a lot what we work on together is that activity of what are we doing here? What is the decision we just made? Is there a decision to be made? Is there another way to think about this? And that's a continuous, ongoing activity that we're doing together. And I was thinking about, in preparation for this, I read the beginning introduction to this book, which is Fred Newman's book, who was the founder of the East Side Institute, where we are. And one of these, he was talking about about the philosophy of decisions and things. And I want to read it because I really liked it, because it's in those very moments when we're caught up in the immediately pressing practical questions of everyday life, like, should I be buying chicken or hamburger for dinner? Here's this example. We need to recognize ourselves as the makers not only of hamburgers, but also of the ongoing creative social process that is history, which is the totality of what there is. And the point is not to know history, the subject, but to see yourself as a maker, a performer of history, the collective life that human beings create together out of what there is. And, you know, I think I found that to be not an abstraction in any way, but something that each of these times that somebody gives you the blood test, or, you know, go to see an orthopedist, or it's I think, important for us to kind of see those as decisions that are being made. So if you're going to go for a heart test, there's probably 10 things down that road that the results of the heart test might show you that are going to pull you down that path of decision making. So I think that and choice and those kind of things. And I think that those are something that as the, you know, people who are sitting on the other side of that, I think it is very important for, as patients, to be saying, well, what, even the blood test, what are you ordering? Why are you doing this? What does it mean? What are the implications of that? Or how is that going to fit into my needs and wants as a person? And, you know, that has an impact on, I think, how we see ourselves. And I think that's how I found one of the things that can be very helpful to my patients about is just literally thinking about what decision making is, or what that process is, and how people can be more engaged in that process. I think the other thing that I found very, very helpful in thinking about decision is it's a continuous ongoing process, that the process of making the decision is inseparable from the decision. So that you, I think many ways, the more it's the, for those people that know that, tool and result activity. It's building the boat as we go across the water. We're constantly creating it. And as creators of this process and answers to our health issues, you will be doing that in an ongoing way, as opposed to simply saying, okay, I've got this piece of information, then I'm going to make choice A, B, C, or D.